But the major problem with patients with PV is the development of myelofibrosis. Okay, so in this slide, we see that there's an incidence of arterial and venous thrombosis initially, but as the patients progress, there is still an incidence, a low-grade incidence of thrombotic events. But the major problem relates to the fact that they have myelofibrosis as a terminal consequence of their illness. I think if I just say next slide, please, that would do better. Thank you. Just click it. Thank you. So what we found in the long-term study of our patients exceeding 30 years was that interferon was associated with improved myelofibrosis-free survival in low-risk patients compared to hydrea phlebotomy. And as you can see, there was a 84% remission-free survival at 20 years compared to 65% with hydrea or 40% with 55% with patients treated with phlebotomy only. And the most important thing was that interferon was associated with improved overall survival. Next slide, please. Next slide, please. Interferon was, no, go back, please. Interferon was associated with improved overall survival in patients treated with interferon compared to those with hydrea or phlebotomy. The median survival was 65% with interferon compared to 40 and 14% with phlebotomy only. When a patient receives interferon alpha, there is a reduced risk of myelofibrosis and improved overall survival. So that the myelofibrosis risk reduction for interferon was 9%, and the mortality reduction per year of interferon therapy was 6%, suggesting that the earlier you start interferon in the course of a patient's illness, the better it is.